shown us that change can indeed happen if the right people in the right places are supported and backed to pursue that change. We have seen fantastic examples of our partners accompanying stateless people to ensure that they access vaccines, to our partners advocating for changes to immigration rules, and indeed to ensure that stateless people have access to general livelihoods and other relief measures. And this has all been possible through the community-based approach taken by our different partners around the world who together form this consortium. And what this has shown is that whilst on some matters, COVID-19 has shown that stateless people will be disadvantaged because there are active measures to disadvantage them. In other occasions, people are disadvantaged simply because there is a huge blind spot. And what it requires is a person who's taking decisions from a position of privilege to listen to those who are at the brunt of their decisions and to act based on what they've decided, what they've heard. And so over the last year, the work of the consortium has both resulted in life-changing impacts around these different countries, but it has also resulted in a huge body of evidence and documentation of the challenges that stateless people face and the ways in which these challenges can indeed be mitigated. And we felt it incumbent upon ourselves to share this rich experience and expertise that we had gathered by working on this COVID-19 consortium project together with the rest of the world. And the outcome of that process of sharing is this report. Let me very quickly now introduce our first panelist, who is one of our consortium members, a very active and engaged young activist from Malaysia, Melinda Shalini. She's an intersectional feminist, and she works with the Foreign Spouses Support Group and has been very much at the forefront of a lot of the advocacy, which has resulted in some very exciting and positive changes in Malaysia. But she has also been very much at the forefront documenting some of the real challenges that stateless people face in the context of COVID-19. And so, Melinda, I would like to offer you the floor to begin with, to speak to us about the experiences that you had with FSSG through your work with the consortium, and in particular to talk to us about the efforts that you have taken to address gender discriminatory nationality laws and the resultant challenges that people have faced in terms of being united with their families due to nationality laws resulting in people not having the right to remain in Malaysia. Over to you, Melinda.
Thank you so much, Amal and ISI, for the opportunity for me to present the work done at Family Frontiers in Malaysia, which is the umbrella body for the Foreign Spouses Support Group, as well as the Malaysian Campaign for Equal Citizenship in Malaysia. And also thank you so much for the development of this very crucial report. Good day, everyone. It's an absolute honor to speak at this panel and to be a part of the launch of this report. So we at Family Frontiers primarily work on the rights and welfare of Malaysian binational families, particularly challenges faced as a result of lack of access to Malaysian legal status, with a primary focus on gender discriminatory citizenship laws, as Amal mentioned. So during the COVID-19 pandemic, we saw a range of unique issues that our communities were placed in, which were mostly unprecedented. So a major issue that we worked on was on freedom of movement, when we saw initially non-citizen spouses and children of Malaysians without a long-term visa were prohibited entry into the country. And this placed Malaysian binational families in precarious situations, especially leaving women and children in vulnerable situations. So we worked on this through a multi-pronged approach by engaging with relevant agencies and heavily relying on the media to platform lived realities, because at the start of the national lockdown, we also saw a change in the Malaysian government, which meant that we lost a lot of our focal points in key ministries and government agencies. However, through this multi-pronged approach and also, consistently relaying information on the ground to relevant stakeholders, it resulted in practical reforms to immigration regulations. Some other issues also included the case where non-citizen children and spouses of Malaysians were being asked to leave the country merely just to enable the application of their visas. So after lobbying and also again here sharing urgent cases of those impacted by these policy directives, applications were accepted without directing them to leave the country. And throughout this process, Family Frontiers offered consular support through our online public service platform and our close-knit peer support networks that assists binational families through the family unification process that was during COVID, but also on a regular basis on cases such as civil registration, application for citizenship, access to legal status, and a range of other issues of fundamental rights. In order to strengthen this access to information and support among Malaysian binational families during the marriage migration process, and also while they navigate through bureaucratic processes to obtain a Malaysian legal status, through the CESF project, we also initiated engagement with service centers of members of parliament, because most often they are the first point of contact for families in the constituencies, so that their capacities to support the focus population is strengthened and we can help build sustainable resources. As mentioned by Amal as well, a major focus of our work is on discrimination in Malaysian citizenship laws and the impacts of unequal access to Malaysian citizenship on women and children. And this was particularly heightened during COVID. So a bit of context, Malaysian citizenship laws do not allow Malaysian women to confer citizenship on their overseas born children by operation of law. So this leaves many children without access to Malaysian citizenship or even at risk of statelessness. And this has placed families in precarious situations during COVID. And due to the inability to travel during the pandemic, and also with difficulties with civil registration, we will see an increase in the number of these children without access to Malaysian citizenship, including a heightened risk of statelessness when the child does not have access to the foreign parent citizenship, and also when the child is born out of a legally recognized marriage to a Malaysian father and a foreign mother. Again, on this issue as well, we've been working on evidence-based engagement with policymakers to make a case for law reform by consistently, again, platforming lived realities, all aiming towards increasing the awareness of discriminatory citizenship laws among the media, general public, and policymakers. We also currently have a case in court for equal citizenship rights of Malaysian women and their overseas-born children. So what led us to utilize the courts for access to justice is the unique situations that these laws gave birth to during the COVID-19 pandemic and the urgency and the lack of engagement or inability for us to engage with people in power in order to push for this reform. Again, going back to the larger context of the situation in Malaysia, and also when you get a chance to read the wonderful report that ISI has put together, I do agree that there has been an increase in xenophobic sentiments in the country, which has resulted in a fear of arrest, detention, and harassment. And it also kind of hampers the right to healthcare because it increases the fear of stateless persons or those without a valid Malaysian legal status to come forward for testing or vaccinations. And we also see that stateless persons and non-citizen children of Malaysians also cannot access public healthcare at the same rate as citizens, incurring higher costs of healthcare. During national lockdowns in Malaysia, there has also been difficulty in accessing immigration services, with appointments being highly competitive. Some are only able to book appointments 3 or 4 months down the line. And this makes those without a valid visa or a legal status highly vulnerable, especially with increase in police compliance checks or roadblocks. We've had cases of spouses being detained on non-immigration related issues, and later on they switch it to a case of immigration related issues, with even a spouse recently risking deportation. And another major issue as a result of the pandemic that we've seen with our focus population is socioeconomic marginalization, where stateless persons or those without access to Malaysian legal status face challenges with employment, including with obtaining licenses for businesses, leading to loss of livelihood. I would like to appreciate the team at ISI on working on the Together We Can report and developing the roadmap, because when I was looking at the roadmap and reflecting a bit on it, I realized that the work we do on the ground closely resonates with the multi-pronged approach of the roadmap. And I especially resonate with the part on checking for institutional blind spots and ensuring that stateless persons and non-citizen children with either parent who's a citizen are prioritized and included in law and policy directives. Because throughout the COVID-19 pandemic, we have gathered evidence on how our focus population has been impacted. And it's very clear that the lack of access to legal status has placed them in very unique, vulnerable situations, and it cannot be sidelined. So while developing policies and laws, especially temporary special measures that are coming up as a result of the pandemic, policymakers need to work together with the community and also civil society and activists who are in touch with realities on the ground, because we are communicating with communities on a daily basis. Because what we see is that realities on the ground are not being reflected in the decision-making process. So while we have all the evidence on the issue, what we need now more than ever is efforts and initiatives from those in power to address the issue of statelessness and unequal access to legal status, so that the community is not sidelined and there are adequate measures to ensure access to rights and justice. But I guess I just have to add very quickly that during this process, we really appreciate, especially as a very small organization, that we have the CESF community that we feel we can belong to and actually feel that we can fall back on. ISI has been an amazing support for us as well, while we work together to address the issue of statelessness and lack of access to legal status. So thank you.
Thank you so much, Melinda, for that very rich account of all the fantastic work you and your colleagues are doing in Malaysia. And the different strategies that you've used of providing direct support to families and engaging in documentation whilst also taking up legal challenges and direct advocacy with the state. It shows that if you are tenacious enough and creative enough and you look to find a way, you can make progress, because Malaysia has been a country where historically there have been great challenges and there continue to be great challenges with regard to statelessness. But the COVID-19 pandemic and your efforts to kind of draw attention to these issues in the context of the pandemic have started to reap great dividends. So thank you so much, and also for your comments on the roadmap and the consortium. And I will completely second that. It's so nice to work in an environment where you know that you have colleagues around the world who have your back and who have your interests at heart, and who you can always call if you are struggling with how to kind of frame a particular problem or deal with a particular issue. Before handing on to my next speaker, I would just like to take a couple of minutes to talk you through the report itself and some of the main kind of issues that we unpick through the report. So the report is structured in 3 parts. The first part is an introductory part, which also provides more information on the consortium itself, and goes in and then shares the roadmap. And I will talk about the roadmap a little later. And then in part 2 of the report, we look at the global picture and we pick out 5 key thematic priorities to focus on, which are the right to health and access to healthcare, the right to nationality, legal status and documentation, equality and non-discrimination, and then we also look at both civil and political rights and socio-economic rights. And then part 3 of the report is a deep dive into country situations where there are COVID consortium projects ongoing, such as the project in Malaysia that Melinda just spoke to you about. And here we are able to look more specifically at what happens in different countries, both the challenges as well as good practices and the impact that these different consortium projects are making. And so the report really, it tries to tackle the issue from different perspectives and bring together quite a rich body of evidence and material, both to show the existing structural disadvantage that stateless people endure, to also show how COVID-19 has completely exacerbated this and made things worse and made things more desperate and challenging, but also, and very importantly, to show that there is light at the end of the tunnel if we are willing to work together and work really hard to address statelessness. In terms of the challenges, if I was to pick one challenge which the report really highlights in a way which I feel is very compelling, it is that there is a preoccupation in the world, among states, among UN agencies, among NGOs, even among regular citizens. There's a huge preoccupation with documentation and with legal status and with nationality. And this preoccupation undermines people's access to rights by imposing an artificial barrier on what they should otherwise be able to access. And so this situation has really come to light in the context of COVID-19, where people are being denied vaccinations or being denied access to healthcare or being denied government relief because they don't have a piece of paper. And when you stop to think about it, it is quite a tragic situation. And hopefully the report and other efforts like this will challenge us collectively to think differently about documentation, about legal status, and about nationality, and to recognize that the lack thereof is already problem enough. It should not be the catalyst for other human rights challenges as well. On that note, let me introduce our second speaker, Elvis Berisa, who is a Roma rights activist. I'm one of the founders and the current executive director of Firenemenka, which is a Roma rights organization in Montenegro. Elvis has a very impressive CV and track record of working on Roma rights issues and Roma inclusion issues, both with the Montenegrin government and also from the civil society perspective. And Elvis's organization has been doing some fantastic work, like Melinda's has, through the COVID-19 consortium. In particular, Firenemenka has really focused on access to documentation and supporting Roma community members with access to vaccinations. So Elvis, I would like to hand over the floor to you to share with us your experiences working with the consortium and also some of the findings that you all have made through your research.
Thank you, Amal. First of all, I want to say that we are glad that we were part of the impact report and that we were able to give our humble. Thank you to ASI and to also all other our partners in consortium, and I want to also say bravo to Melinda and the work amazing that family frontiers are doing, and also all the other partners in our consortium. So dear all, it's a really honor to be a part of this event, to have a national section in the impact report, and I think I thank you to ASI for recognizing the importance of the issue of statelessness in Montenegro, that mostly refers to the Roma and Egyptian communities. So as you know, maybe some of our participants maybe don't know, but Roma people are the most bigger national minorities in Europe, and the most discriminated minority. Our partnership with ISI took us to the core problem of statelessness in the state, to try to understand the scope of unresolved legal status in these communities. So our partnership with consortium members also brought to light the universal nature of this matter. Situation in Montenegro, but also in North Macedonia, bears strong similarities, both struggling with Roma statelessness for decades. We used to scoping of art visually. First, we mapped all Roma settlements and gain perspective into the number of people who don't have regulated legal status. Out of over 1,000 people covered by the survey, 198 adults and 216 children with unregulated legal status were found. Roma and Egyptian families are mostly with a larger number of children, and almost all children inherit in unregulated legal status. Out of 4 state and aid and financial aid, financial support from the from the government provided in Montenegro, the Roma community with unregulated legal status received none. And almost same stands for the food and hygiene relief. These results are now published in our case study, alongside with personal stories that shows wretchedness of living without any status. This will be followed by a short documentary also. We cannot say that our government was entirely unresponsive to our requests. We started a dialogue and have seen some progress, small but appreciated, I can say. One of the great examples was our effort to include people without unsolved legal status in the vaccination process. The initial national immunization strategy stated that stateless people will be the last to receive the vaccine. Fortunately, this soon changed under our pressure and also NGO in Montenegro. But we are the main pressure was from our side, and because it did not reflect reality, and both Roma and Egyptian were placed in the priority group and in a mass vaccination day. Vaccination both was set up in the heart of Roma community, and people without regulated legal status could get vaccine without the need to show any ID document or any document. Members of Roma community without regulated legal status live like shadows, barely surviving, and they are not only missing documentation, they are missing out on a dignified life. So we need to do a few next step, I can say. Extend state relief, including financial relief, food relief packages and hygiene items to the stateless and undocumented people who are not registered at the Center for Social Work and Care. These people are not in official, for example, database of government. Also, to provide digital tools for online learning, such as tablets or Wi-Fi, free Wi-Fi to all Roma children, including those who are undocumented or stateless. Reopen the public call. This is very important for applications to provide a facilitated pathway to legal status and nationality for all people with unresolved legal status. This call was, just to mention that this call was open in 2014 and 3 or 4 years before that. But from 2014 till now, we have so many cases in Montenegro that they are with unresolved legal status, and this number will multiply in the future period. Because of that, we need to reopen the public call for application for those peoples. Simplify then the procedures to address unresolved legal status and nationality through reducing paperwork and improving digital cooperation between neighboring countries, such as Kosovo, North Macedonia, Serbia, etc. And I think Montenegro has made also pledges to European institutions and international organizations to do everything in their power to help reduce statelessness. This, I think, right now is a time to honor it. So I think we now to react all together. Thank you for all for your attention.
Thank you so much, Elvis, and again for the fantastic example of the effectiveness of advocacy in Montenegro, both in terms of pushing undocumented and stateless Roma communities from the back of the vaccine queue right to the very front of the vaccine queue, which is it's a very impressive accomplishment, and unfortunately, it is the exception where that is the case in the world. We should be moving to a situation where that has become the norm. Thank you also for all the other great work that you are doing in terms of trying to find regional solutions to these challenges as well. And indeed, for ending on the note that together we can make change. Before I move on to talk a little bit about the roadmap, just a quick notice that if anyone has any questions for either Elvis or Melinda, or indeed for the other panelists who will be coming after, please do share your question by using the Q&A button. And we should have about 15 minutes towards the end of the webinar, and we will try to address as many questions as possible. Now, Elvis, you ended with the comment, together we can, and indeed that is something that we feel very strongly in this consortium, which is why we named this report the Together We Can report. And the reason we've done so is because we feel both that there's an opportunity, but also that there's an obligation for those of us who are engaged in citizenship rights issues and statelessness issues to really push for lasting change, to strengthen and the protections that stateless people face, to strengthen their human rights, both in the context of COVID-19, but also in the long term. And this is why we've used this report as an opportunity to also develop the roadmap for change, a roadmap which challenges all kinds of stakeholders, be they NGOs or UN agencies or states or others, to change the way they engage with this issue in order to check for their own institutional blind spots, in order to ensure that they are including and consulting with stateless people themselves and ultimately being accountable to them, and to ensure that their understanding of Build Back Better includes building back better for the stateless as well. And this roadmap is something which we feel and we hope would be a continued contribution to the field, even when the data in this report no longer is up to date. We hope that we can push for people to engage with this issue differently, to realize that unless you address statelessness and prioritize statelessness, you will not be successful in whatever it is that your mission or your mandate compels you and obligates you to pursue. On that note, I would like to share with you a short video that has been put together by some of our consortium partners and members, which looks at the three-step roadmap and provides a little bit of further information as to what the roadmap is about. So if I could ask Elena to share the video, please. Thank you.
Hello, my name is Dr. Grant Mitchell, and I'm working with civil society groups in the Asia Pacific to support their advocacy work on statelessness. In a region with the highest number of stateless people already facing entrenched exclusion and inequality, the COVID-19 pandemic has had a further devastating impact on people's rights, health, and well-being. This report, Together We Can, comes at a critical time, highlighting the gravity of the situation facing stateless people globally, but also providing a way forward, a practical roadmap to address both the discrimination and exclusion of stateless people in the face of COVID-19 and beyond. The pandemic has clearly shown that it is in everyone's interest to include everyone, and we encourage all levels of government, UN agencies, and civil society to use this roadmap. A key starting point is to check for institutional blind spots, for all stakeholders to carefully assess and acknowledge and work to understand the contexts that have led to statelessness, the extent and impact of exclusion, and the resources and responses needed to address these. This work must be done together with stateless people to understand their experiences and the solutions that they can share to address the deep structural problems that affect their daily lives. Thank you.
Hi, I am Karina. I am a founding member and currently serving as the Executive Director of United Stateless. We are a national stateless-led organization dedicated to building community among stateless people and allies in order to advocate for our human right to a nationality. I believe in order to end statelessness, we must work together. The second step of the roadmap calls for inclusion, consultation, engagement, and dialogue. This can only happen if stateless communities are centered through consultation, their active participation efforts to address statelessness, and if genuine steps are taken to build trust and extend solidarity towards stateless people. The roadmap advocates for a change in a way that is representative of the diversity of stateless people through our individual stories and experiences. It is also clear ending statelessness is a long game. We cannot end statelessness by ourselves. We need allies and partners.
COVID-19 has shown us that discriminating and excluding individuals and communities from citizenship and other rights weakens our collective capacity to fight global challenges and develop in a fair and sustainable manner. Hi, my name is Ravi. I work towards equality and dignity for marginalized communities and advocate for everyone's inclusion in India. My organization, Development and Justice Initiative, works to address statelessness arising out of the National Register of Citizens in Assam, and we are members of the CESF Consortium. COVID-19 has starkly exposed the structural factors that increase vulnerability of stateless people. We must reevaluate these factors, including discriminatory laws, policies, practices, and social attitudes to combat intergenerational statelessness. We must be accountable to stateless people and commit to building a just and inclusive societies by focusing our energies correctly. We have to build systems that treat minorities with dignity and enable them to participate in a democratic consultative decision making. This is why we hope all stakeholders will get behind the idea of building back better as set out in our roadmap for change. Thank you.
Thank you. If you want to find out more about the work that Ravi's organization, Development and Justice Initiative, does, they are also one of our consortium members, and you would find out more about that in the India chapter of the report. And we're also delighted to announce that United Stateless will be joining the consortium. And so they will also become part of our little group of actors fighting to address the injustice of statelessness around the world. May I now, it's my pleasure now to invite our two discussants to join the conversation and to comment both on the report and the roadmap, but also on what you have heard in terms of the interventions from both Melinda and Elvis. So I would first like to invite Monet Zad, who's the director of the Forced Migration and Health Program at Columbia University. And we are very happy to have you with us, Monet. Thank you so much for joining our webinar. And I'd be very keen to hear your thoughts on what you've read and what you've heard.
Well, thank you. It's a pleasure to be with you today. And I want to commend ISI and the consortium on an incredibly thoughtful report, very rich, full of very practical examples of things that can be done. And also the previous speakers, I think they were really inspirational in the strategies they adopted under really extreme pressure to ensure that stateless populations that they were serving and working with were able to access their rights during this very difficult time. So, you know, obviously I speak from my vantage point in a public health school. And so I've been really struck by one of the issues that I think has emerged clearly both in the report as well as in the interventions today about legal status and how often legal status is used as a way in which to determine what rights you have access to. And so, you know, I think the report goes into great and useful detail about the importance of status and why these structural issues matter. But of course, from my perspective as a public health school, I think that legal status should be irrelevant to crafting effective public health responses. And out of this pandemic, I think what we've been hearing is there are some opportunities to really make the case that for certain basic rights, the right to health being one of them, legal status should have no place in determining the ability of individuals to access their rights. And thinking about those opportunities, I think the report really profiles some of them well. We've already heard about the incredible work being done by Elvis and his colleagues. But we can look to the example of Ireland and Portugal, which extended testing and treatment to undocumented populations at the height of the epidemic. And I think we should really very creatively as an advocacy and public health and rights community use some of these examples to build momentum around the idea that the right to health is universal and legal status has no place in determining whether or not you're able to access basic health services. I think that's particularly critical as we go into this discussion and into this question of vaccines access, because we see around the world the nationalism that has infected the response, the closure of borders, potentially also making its way into the vaccine debate. And I think it's really critical that we assert universal access, needs-based criteria, science-based criteria for who gets vaccines access, and what priorities should be set. So in that sense, for example, I'm somewhat concerned when I look at the way in which our community has held up the example of Colombia and the regularization of Venezuelans in Colombia as being one of the mechanisms that people are very proud of in terms of ensuring access to vaccines. As a public health worker, I think, oh my goodness, this is not what we should be pushing for. Regularization takes a long time. It is completely unethical to make these populations wait for these regularizations processes to unfold. And so as laudable as that initiative is in its own way, it should not be the criteria for determining who has access to vaccines. So I think we are at a critical moment where, frankly, we can capitalize on the momentum and some of the incredible work that has been done to make the case as to why the right to health should be universal, why legal status has no place in some of the decision-making here. But it could also go the other way. And if we're not careful as a community, I think we could also see nationalism win out. And I'm particularly conscious of the kind of urgency of coming together, which is why I think the Together We Can report is coming at such an important time.
Thank you so much, Monet, for those comments. And I completely agree that the timing is very delicately poised in that there is definitely an opportunity to capitalize on the fact that people's eyes may have been open and should have been opened by the pandemic, but also there is a great risk, and we are seeing this in many countries, of clamping down, of putting citizens first, and in fact of scapegoating migrant stateless people and refugees. The point about the right to health being a universal right, it's absolutely well made and well taken. And it's interesting, I mean, as a person who's worked on the right to nationality for a number of years, when you study the rights that are enshrined in the two covenants, you would see that it's only the political participation rights and in certain contexts, economic rights, which can be restricted to citizens. But then when you look at the lived experience of stateless people, you find that their lack of legal status is the basis on which they are denied access to other rights. So there's a huge amount of work for us to do here. And indeed, COVID-19 could prove to provide the impetus to make some headway in this regard. I'd like to bring in one of our consortium members, Bridget Wooding, who is with OBMICA in the Dominican Republic, who has been working for a number of years on these issues of documentation and access to rights. And Bridget, I'd like to invite you to make a short intervention, to which I would then invite Monet to respond to. So over to you, Bridget.
Yeah, thank you, Amal. Good morning, everybody. It's also my pleasure to be here representing one of the consortium organizations working here in the Dominican Republic, the Dominicanos por Derecho platform, a platform which advocates for the right to Dominican nationality for mainly people of Haitian origins who've been denationalized. The good news from here in the Caribbean is that from an initially hard line of only including documented Dominicans in the access to vaccines, now all age 12 upwards residing on Dominican territory will be included. Now, this is all very recent, so actually the ISI report is slightly out of date on this, but it's all in a positive sense that partly because of our advocacy, things are moving forward. Now, this is important because official figures show upwards of some 90,000 persons stateless or at risk of statelessness, despite legislation intended to remedy this since 2014. And at the same time, there's been a regularization process for mainly Haitian irregular migrants in place, but many are out of status. And equally, the so-called normalization process is in place for Venezuelan migrants, but their status is in process. However, the situation is particularly concerning for Haitians and descendants of Haitians born in the Dominican Republic, who, despite a century of labor migration to the Dominican Republic, suffer structural discrimination. So the challenges are many, but we do have a broad civil society coalition which is making overtures to Dominican authorities with a view to seeing how we can all work together, including with international organizations, to bring vaccines to hard-to-reach populations. And the particular challenges are with this lack of documentation and to look at creative ways around it. So even before the government announced this welcome news that everybody was to be included, local authorities were being approached by community leaders to look at creative ways around this lack of documentation. So in short, there is a great potential to inoculate all in the Dominican Republic, but the challenges remain to ensure the implementation on the ground of the new government policy, putting into practice and ensuring a firewall between migration and public health, so persons are not unwittingly subject to possible detention and deportation, especially to Haiti, which would be expulsion in the case of Dominicans of Haitian ancestry who might be racially profiled in that way. So while I take on board very much the principled stand of Monette in terms of health is a right, for the moment, what we do have is an initially hostile environment towards groups not holding Dominican documentation. So the challenge now is for us is to how to move around that initially hostile environment. And in the first place, that may well mean, moving for documentation where that can be attained more rapidly, taking on board the fact that beyond, so that this becomes an opportunity, so that health is not seen as a favor, vaccines are not seen as a favor, but we do indeed end up building back better once the pandemic is over. So in short, very interested in learning from positive practices elsewhere, where these initially hostile environments have moved to something else, and there have been good practices in terms of how that's happened. So thank you.
Can I jump in, Amal?
Yes, please do, Monette. Yes.
I think, I just really wanted to commend you for that work. And I love the real contextualized, granular, community-based approach that you've taken to, I love the other term you used earlier in the panel was accompaniment, the idea of accompaniment in every sense, legal accompaniment, but also, the nuts and bolts of making sure that people are able to access the services that they need. And I think this is exactly the right approach. And I think you're right in saying that, every context is a little different. And if there is an opportunity to, I think, build back better and institutionalize and, create a regularized status for communities, then we should seize those opportunities and certainly do that. I guess my point is that we need to be mindful that, the health imperative may be more immediate and to try and push forward this idea that, you know, an obsession with status is determining the gateway to these very essential basic rights may not be well placed, you know, in a pandemic, but even beyond when it comes to the right to health. And I mean, pre-pandemic, there was a movement afoot to talk about universal health coverage. And, you know, it ebbed and it flowed, as many UN processes are wont to do. But I think there is an opportunity coming out of this pandemic to really make the case for universal health coverage and to separate it from this question of what your legal status is, because I do think that health is a universal right, and we should stick to that if we can, bearing in mind context differences. The other thing that I think is really important coming out of your remarks is, you know, the other barriers that communities and individuals face when it comes to vaccinating or seeking testing or treatment. And so we may solve the problem on paper, either by saying documentation is waived or by figuring out the paperwork, but trust is a whole other matter. And that's where, again, I think that your approach is so critical, because this idea of accompanying and making sure that these populations that have been marginalized, ostracized, and persecuted feel confident coming forward to the authorities to you know, claim this treatment is really important. And the barriers are numerous. You know, they could be cost, but in the immigration context and the statelessness context, it is really the persecutory state and often private actors in health facilities that also are regarded as being you know, sort of obstructive to stateless people in different ways. So I really think you're holding up an example of the work that needs to be done at community, but also the work that needs to be done at the legal and policy level. And this question of the firewall that you raised is absolutely critical. It needs to be there in law, but it needs to be monitored and supervised really closely because of this trust issue. And because many of these governments will just find it so irresistible to be able to tap into the information that is being gathered for health purposes and use it for other purposes that are more malign.
Thank you so much, Monet and Bridget, for that exchange, which I found fascinating, and I could have listened to the two of you speak for much longer, but we do have to move on because we still do have a lot to get through. I mean, the barriers to access to healthcare and the fear that people have of authorities and the distrust that they have, it comes out very clearly in the report as well in a number of countries. And so that I think that point is absolutely spot on. Let me now move to our next discussant, who is no stranger to ISI or indeed to the consortium. It's Sam Walters, who's the Associate Vice President of Programs at the American Jewish World Service. And Sam is both a COVID-19 Emergency Fund committee member, which means that she does sit in on some of the decisions around kind of approving projects that the consortium puts to the committee. But Sam also represents AJWS, which is a donor of the committee and a much loved donor of the committee at that. So Sam, as an insider outsider, as a donor and as a committee member, I would love to hear your reflections both on the report and the roadmap, as well as on the presentations that have come before you. Just before you speak, one more announcement. If anyone does have any questions, please do share them now via the Q&A button, because we are coming towards the end of our session. And if you want to get your question in, please do so now. Thank you.
Great. So thanks so much, Amal, and to the entire ISI staff, whom, yes, AJWS adores, for organizing both this important event, but also for creating a thoughtful, practical report that's both meaningful for practitioners, of course, the stateless community, and for donors as well. My organization, American Jewish World Service, or AJWS, supports locally led organizations in 16 countries around the world. And we support marginalized communities, including LGBTQI people, sex workers, indigenous communities, and of course, stateless people, including the Rohingya. As noted in the messages section of the report, we knew that COVID would further exacerbate the inequalities that these communities already face, but we could not have anticipated the extent to which the pandemic would disproportionately affect these populations. For stateless communities who already face intense discrimination, both from governments and civilians, as my fellow colleagues have already spoken about, COVID-19 has provided yet another avenue for these groups to face bigotry. We're seeing governments scapegoat stateless people, blaming them for the spread of the pandemic, not unlike the experiences of the LGBTQI community in Liberia, who was blamed for spreading Ebola in 2014. As my peers on this panel discussed, this discrimination lends itself to deeply dangerous practices that increase threats to the safety and security of stateless people all over the world. They are at a heightened risk of experiencing violence from civilians, governments, and police, military, as a result of baseless claims that they're somehow responsible for this spread. A lack of formal legal documentation also prevents them from accessing vital services, including healthcare, as we just discussed, vaccines, and government support schemes. And while these are sadly all risks that people faced before the pandemic, they've been further compounded by the secondary effects of this pandemic, such as the brutal economic downturn that many countries have faced and continue to face, as we're seeing now in Uganda, India, and much of Asia and Africa. In the absence of formal legal status, most stateless people survive through their work in the informal economy and have lost their livelihoods, and in many instances don't qualify for financial support from governments. It's also apparent that COVID has demonstrated the very significant gaps that remain in the field of both humanitarian response and human rights, and the extent to which we're unprepared to respond to crises of this magnitude, let alone multiple crises at once. You may remember through the grand bargain in 2016, we, both the international donor and INGO communities, primarily working in the field of humanitarian response, publicly recognized the importance of having local actors drive their response to the increasingly dire, complex crisis that the world is facing. And yet, despite this, as we know, in the 5 years since, we have failed to hold up our end of the bargain and actually listen to local actors on the ground who understand the context and the way in which they live that we could not. This has also prevented the field from understanding the experiences that marginalized communities, particularly stateless people, face and what they think the response must be, particularly in times of crisis such as this pandemic. While this work is daunting and challenging, this roadmap noted in the report lays out clearly and concisely the work that donors must and should do if they want to holistically address the most pressing humanitarian and human rights issues of our time. We must listen to the experiences of stateless communities, recognize the gaps in our existing knowledge, and bring this key population into the key decision-making spaces with other stakeholders to ensure that their rights are respected. Donors must allow stateless communities to be in the driver's seat when it comes to identifying their own needs and the solutions to the challenges that they're facing. And as COVID has taught us, crises exploit existing inequalities to an alarming extent. As donors, we must address the structural issues that have made the situation for stateless people around the world all the more precarious as a result of this pandemic. We must remain committed not to just restoring the pre-COVID status quo, but actually building stronger and more equitable societies. Thanks so much, Amal, and of course to the ISI team.
Thank you so much, Sam, for those strong comments and the strong endorsement of the report, but also of the importance to listen to and be accountable to stateless people, which we fully get behind. On that note, I think it's quite pertinent that we bring in Ali Johar, who's a fantastic Rohingya activist and a member of our COVID consortium, to share a brief comment of around 90 seconds, which Sam, hopefully you'll be able to respond to as well. Over to you, Ali.
Thank you so much, Amal, for giving us opportunity to participate in the report. So Myanmar's imposed statelessness on the Rohingya is related to restrictions on a range of fundamental human rights, including freedom of movement, right to work, access to education, and right to marry and have children. since the mass exodus of Rohingyas in 2017, there are approximately 500,000 Rohingya remaining in Rakhine state of Myanmar. Most are in confined situation, with hundreds of thousands living in IDP or detention. Since recent military coup, civilians are being targeted with violence, killings, and arbitrary arrests. Hundreds of doctors have been arrested, and many hospitals have been occupied by military force. Deaths and impact remain unreported and unclear in Myanmar. This is particularly alarming due to the dramatic rise in COVID-19 case in neighboring countries in this region. While in Bangladesh, more than 1 million Rohingya refugees are still waiting for COVID-19 vaccines, they have faced arbitrary detention, devastating fire incidents, and lack of food as well as access to basic sanitation. Our survey says 54% Rohingya female have no access to female hygiene materials. 84% Rohingya respondents say they have decreased their consumption or adopted a negative coping mechanism during the pandemic. In India and Malaysia also, Rohingya refugees are yet to be included in vaccination drive and were excluded from government relief during the pandemic. Xenophobic campaign during the pandemic has made many Rohingya homeless, especially in Malaysia and India. School-going Rohingya refugee children in most of these Asian countries, including India and Malaysia, are being largely dropped out due to lacking of equipment to attend online classes. In Bangladesh, a country where Rohingyas children are not allowed to attend formal schooling, children's centers are being shut down in the camps. Arbitrary detention has been increased in Bangladesh, India, and Malaysia. Reportedly, all of these countries tried to deport Rohingya refugees, including India attempting to deport a minor Rohingya girl to hostile Myanmar during this pandemic and shut their borders to refugees. Several Rohingya reportedly did not visit healthcare facilities due to fear of getting detained or being deported. Majority of the Rohingya women were excluded from COVID-19 awareness program in these countries. And with support from ISI and CESF, we were able to reach out to hundreds of grassroots Rohingya women and men who were not part of any awareness program on COVID-19. We call upon these countries to ensure that all Rohingyas on their territories have access to COVID-19 testing, healthcare, and vaccination scheme on an equal basis to citizens. Thank you so much.
I'll just jump in and echo everything Ali's really important words and advocacy. I think for the donor community on this, in this meeting and part of this conference, just emphasizing the importance of funding local Rohingya groups directly. As Ali said, the situation in Cox's Bazar in Burma is really dire. There is no access to the vaccines, to healthcare, to even education, or a lack of right to even earn a livelihood. So really important that both the INGO communities step up and not retreat to the convenience of being overwhelmed, but also the human rights donor community, that they really focus on funding Rohingya groups directly. So thank you, Ali, and of course, Amal.
Thank you so much, Sam, and thank you, Ali, for your important words. It's always such a pleasure to hear you speak. Let me now turn to our final panelist, who unfortunately can't be with us live today. It's Dr. Santino Severoni, who is the director of the Health and Migration Program at the World Health Organization. He had to attend to some urgent business, but he has very kindly shared with us a video message, which we will play now. We are playing a truncated version of the message due to time considerations, but we will have the full message available via our ISI website after this event. So over to my colleague Elena to play this video now.
Good morning, good afternoon, and good evening. I would like to thank Ms. Laura Van Baas for the opportunity she gave me to contribute to the report Stateless in a Global Pandemic, but also the possibility to contribute to today's meeting. I'm really sorry not to be there with you in person, but my appreciation and support for this initiative is definitely fully. The impact report on stateless in global pandemic is a wonderful piece of work of high profile from the technical and scientific point of view, from the data and from the detailed description of the situation observed for this important group of population. The report is also a wonderful opportunity to switch on a light on a group of people which I define the vulnerable of the most vulnerable. Really, the condition faced by 15 million people around the world in condition of stateless is certainly an issue that can be defined as sort of emergency in terms of deprivation of access to basic service, protections, and rights. The report has a particular importance at this time where the pandemic has been showing to all of us how fragile are our societies, where existing inequities have been exacerbated by the pandemic, and those in more vulnerable conditions, often they end up even into more critical conditions because of the situation related to the pandemic. In my area of work, we are engaging in ensuring inclusion of migrant and refugees in the public health policy and approach, and to support countries and advise countries for an inclusive health systems approach. The reality of stateless is extremely concerning because in the reality we are observing every day, we see that states, countries, societies, which they tend to define population based on nationalities and based on the need to implement a border control, tend to artificially, administratively code or regroup populations. And this is directly linked with a legal framework which is managing those populations. And from the public health point of view, this is bringing to a very concerning condition of inclusion or exclusion according to the group that those populations are belonging to. The case of stateless is certainly the most concerning because they tend to be in a group that systematically are not just deprived from access to basic services, but also they tend to end up into a spiral that sooner or later lead into the darkness and leading to forgetting this part of the population in our society. From the public health point of view, we spend a lot of energy to explain that it's not just a public health principle to promote an inclusive approach, because every time we are excluding from our effort in securing access to preventive or curative service of a part of the population, we are putting a seed for a possible public health threats in the nearest future. The reality faced by the pandemic or with the pandemic of COVID-19 reconfirm what we scientifically know already well, that we need to reach out the entire population in terms of protection, in terms of providing access to preventive and curative conditions. But also the pandemic due to coronavirus told to us and reaffirmed to governments and to our member states how health cannot be tackled alone as a subject, as a sector alone, but the health outcomes are directly linked, interconnected with other sectors of our societies, and interventions in other sectors of our societies that have a fallout on the health status of the population and the health outcomes. Then when the situation is as such, like in the case of Stateless, that also the legal conditions, the basic legal conditions are lacking in order to include this population, what we are observing is dramatic. But the main learning from all this experience that this cannot be considered a charity, the access to a system cannot be considered a charity or an emergency situation only. The learning from the pandemic, the size of mortality related to the pandemic should tell us that probably we need to revisit, reconsider how we are shaping our societies. And we need to engage now, because now the government of all countries around the world are thinking how our society is supposed to look like after the pandemic, to make sure that we also put efforts in reducing inequity, social exclusion, and we have as much as possible a system, but societies which are inclusive and taking care, especially of those in conditions of vulnerability. I would like to wish you with this a successful meeting, and looking forward to continue collaboration and to continue the exchange of information, research, in order to support and to bring this issue the attention of the most, and progress in protecting this part of the population living extraordinary condition of vulnerability. Thank you very much.
And thank you to Dr. Severoni for sharing that video message with us. And we certainly do intend to follow up the conversation with him to discuss ways in which the WHO could also strengthen the inclusion of stateless people in the context of the COVID-19 pandemic and beyond. We're coming to the final 15-20 minutes of our launch webinar. And I would like to, in a moment, invite our panelists to share their concluding thoughts. And I would put a question to each of you. We've got a few questions in, which I would put to some of you as you share your thoughts. But before we get to that, I would like to invite Mustafa Mahmoud, who is with Namati. He's a senior program and advocacy officer of Namati. And he is also another committee member of our COVID-19 consortium. So again, Mustafa, you've obviously been engaged in statelessness related work for many, many years now, both in Kenya as well as in other countries. And you've seen the consortium operate both from the inside as well as you've seen the report. And we'd love to hear your thoughts in terms of the report and its findings, as well as some of the interventions you've heard already today.
Well, thank you very much for giving me this opportunity. Just from the title itself, Together We Can, acknowledges that the fact that we cannot solve the problem from outside in. So we have to solve the problem from inside out. So basically I agree and reflect with Sam's remarks. For us to be able to achieve the solutions that we want, it needs to be driven by the stateless communities themselves and community organizations within and next to the stateless community, because one, there's the trust level that is already there, and two, these community organizations are from this stateless community or at-risk communities. So from my work experience, we've worked with paralegals, which these paralegals are employed with by community-based organizations that are either from this stateless community or at risk of statelessness communities, like the Nubians in Kenya. We've also worked in Bangladesh with communities that were formerly stateless. We've seen the success of having paralegals. And the report itself acknowledges this practice of having paralegals who don't solve issues for communities, but direct communities towards the solutions that they want. So they help the community to vision the situation that they're in, what solutions that they want, and they put them at the forefront of achieving these solutions. So I feel like from the title to the approaches that have been highlighted in the report, I feel like it's the best approach, whereby we realize that together with these communities, empowering these communities that you have the solutions is the best approach. Because I once said, governments shut down institutions, but they never shut down communities. And this report clearly reflects this. Whenever we give the communities the tools to solve their problems, we achieve more than solving the problems for the communities. So I really think the report came at the best time. And if we could have more donors in this field, we could be able to achieve more. So we need to have more of these community-driven approaches. And I really think this report should be widely circulated so that more people could see these best practices that are community-centered. Thank you very much.
Thank you so much, Mustafa, for emphasizing the importance of community-centered approaches and paralegal interventions. And indeed, this is who you are. You've been a community organizer and a paralegal worker, and now you support other paralegal workers and community workers. So it's fantastic to get that endorsement from you. And if I go back to the little exchange between Bridget and Monet a little earlier on, the importance of accompaniment, both to help people navigate complex processes, but also to have people do that with someone who they trust when they're often encountering a state or an entity who they don't trust or who they're fearful of. It's so important. And this is not necessarily what leads to policy change, but it does lead to people's lives improving. And when that is accompanied with other approaches that's targeting policy change, that's showing the evidence base for why policies must be changed, then we are really onto something. So thank you so much, Mustafa, for your intervention, and please do stick around with us until the end of the webinar. Just a couple of quick announcements before we ask our panelists to make their final interventions. On Monday the 21st, that is next Monday, we will be conducting a similar event to launch the report, but in the Asia-Pacific region. So we will be targeting Asia-Pacific audiences, and we will be pulling out issues from the report which are particularly pertinent to the Asia-Pacific region. We also will be having a number of national launches, which will be implemented by consortium partners in their own countries. There will be a launch in India towards the end of this month, and once that date is firmed up, we will share that information with you via our channels. And I'd like to invite Bridget to very quickly announce the Dominican Republic launch, which is happening tomorrow.
Yeah, thank you very much, Amal. Yeah, we're really pleased to announce the launch of the research that we did in the south of the Dominican Republic on COVID-19 and the extra layer of difficulty it placed on people already with difficulty in terms of their documentation and registration of their children. So we'll be launching that report and together with testimonies, linking it up with the global ISI report tomorrow, between 10 o'clock and 11:30 Dominican Republic time. And there is simultaneous translation, Spanish, English, for anybody who's interested in getting a closer look at what's going on in the Dominican Republic. And I think in the chat, you'll find the invitation to that launch. So yeah, all welcome. And thank you for allowing me to do that plug, Amal.
No, thank you. It's such an important context that it's really important that more people are aware of what's happening in the Dominican Republic. We're now into our last 10 minutes, and I'd like to invite our two panelists, Melinda and Elvis, and our two respondents, Sam and Monet, to switch their videos on and maybe share some concluding thoughts with us. And what I would like to do is maybe start with the discussants, and I'm going to put a question to you that has come into us and ask you to maybe reflect on that whilst making your final 2-minute closing comments. And this is the question that's come in. Looking at the roadmap that has been derived from the experience of documenting and responding to the COVID-19 impact on stateless people, do you think that the steps that have been set out would be useful as a framework also in addressing other structural issues that stateless people face beyond the pandemic? And if I may actually add to that question, do you also think that this roadmap may be a useful way of thinking of other communities and other issues, not just statelessness, but other groups who are also marginalized and excluded? Let me start with Sam and then move on to Monet. Let me start with Monet and then move on to Sam. Sorry.
I Well, I have to say that for me, one of the quotes that I'm going to take away with me from today is governments may shut down institutions, they don't shut down communities. And I really think that that thought from Mustafa is one I'm going to sort of hold in mind, because it's so, I think it goes also to the roadmap. And one of the things that I think the roadmap is saying very clearly is that, you know, it's not just the right thing to do to involve communities in shaping the responses to the challenges that they face. It's the effective thing to do as well, because we have seen from what you have cataloged in the report, just a real depth of really sophisticated approaches to very complex problems that I don't think could have been forged without the leadership of local communities. And so, you know, I think this is absolutely applicable beyond the pandemic, and I think it's certainly applicable beyond the statelessness issue. I think this is the way you do effective rights-based social justice advocacy. And at the core of it is this question of power. Are we, those of us that sit in either INGOs or donor communities, or you know, in situations where we're able to influence policy, are we willing to share power and open up a seat at the table that has power attached to it? And I think that, to me, is the message of the roadmap in many ways, and I endorse it completely. I do think, just in terms of my final comment, I feel we are at an inflection point on both the statelessness issue, but also on this broader question of, are we going to be able to craft, going forward out of this pandemic, a more inclusive and equitable system? And when I reflect on the conversation so far, you know, the glass half full to me is what we've seen in terms of approaches that you've documented around access to health services, regardless of status. What I see is the fact that, you know, when INGOs withdrew, local actors, community-based actors kept services going in their community. And so if you ever needed an argument for localization, this is it. Nothing collapsed. In fact, I think things were done rather well in many contexts that were very difficult without necessarily having someone, you know, pile it in. But on the glass half empty, I do think that when we look to the way that freedom of movement is being reconfigured in this post-pandemic, we're not in a post-pandemic world, but as we come out of this pandemic, or as we try to restart mobility, mobility is being attached to testing, treatment, vaccination, a whole layer of things that are a new form of exclusion for stateless populations, refugee populations, and asylum-seeking populations. And so we just can't let this happen. And these debates are happening today. And we need to make sure that your consortium members and those who care about the rights of populations who are stateless, who are on the move, are somehow brought to the table as we reshape what mobility looks like in this post-pandemic world. So to me, that's the glass half empty part. And I think there's a lot of challenges there as we think about what that might mean for our populations that we care about.
Yeah, thank you so much, Monet. I mean, so insightful, and you really captured the urgency of why we need to act now. Sam, do you have any comments?
Yeah, just two quick comments. Echo everything Manette so eloquently said. I also will say that for the human rights donor community, it's incredibly important to prioritize this as a core issue that you're addressing in your portfolios. It is not separate from the more traditional human rights issues. It's completely intersectional. So really emphasizing this point with the donor community, and also last but certainly not least, ensuring in the issue of power that Manette just addressed, that stateless people themselves are dictating the terms of the solutions to the challenges that they're facing. So thank you again.
Yeah, thank you so much, Sam and Monet, for your interventions. And I think the power, the question on power is so important, and I'm glad that both of you raised it. And it's important because in many contexts, I would go as far as to say in most contexts, statelessness is deliberate, it's intentional, and it's the use of power to exclude minority communities, communities of migrant heritage, etc. And we already therefore start this conversation from a place of immense power imbalance. And everything we can do to try and rectify that we must do to rectify it. Let me now turn to Melinda and Elvis for your concluding comments. And again, I'm going to put one of the questions that we received to the two of you for you to reflect on and to try and answer in making your concluding comments. And this is the question. Based on your experience with the model that you adopted for joined up work in response to the pandemic, do you see the same model also working in tackling other global challenges that stateless people are affected by, such as racial discrimination or climate change? So it's basically a question around how important is the consortium approach, and do you think we need to find ways to replicate this kind of working going forward as well? Let me first ask Elvis to respond to that question and also share your concluding thoughts.
Thank you, Amal, and thank to our participants also for question. So I will be very, very short in my answer and concludes. So my opinion is that really things have to change. We should all create simultaneous pressure, joint action to ask for global changes that would result in national improvements. How? It's a question to us as a member of consortium, as a member of civil societies. For example, I want to share with you, ESI is informed about that, but for our other participants, for example, in 2019, we become a member of European Network on Statelessness. And in 2019, we started to work and to deal with people who are at risk to be stateless, but we didn't know that they are stateless, because we didn't have knowledge and skills to fight, to organize some activities, to how to go to community and to identify the problems, and then to prepare and to advocate for solving the problems and the issues. So after that, we meet the Laura and the other and you, Amal, and the other representatives of ISI, and we connect also ENS, ISI, and now all the other members of consortium. So I think we really now need to use our power, which we have. Maybe we are not aware what power in this moment we have, even though we are not institution, but as Mustafa said, the government can't stop our voice and the sentence, which is very, very powered. So we really need to use our connect and networking, and to really find a way how to fight not just stateless issue, but also such as racial discrimination. Because, for example, in Montenegro, the most number of people who are with unsolved legal status are from Roma community, and in Europe, Roma are the most discriminated minorities, in Montenegro also. And we cannot say that this is not somehow anti-Gypsyism factor. So indirect discrimination against Roma people, and we need to be aware on that, and also not to sleep, but to wake up and to fight. So this is shortly.
Thank you so much, Elvis, and for, I think, making that really important point that we learn so much from each other.
Yep.
The more we are in conversation with each other, the more we learn about our own unique national context. We learn so much and we pick up so many ideas. And also the point that statelessness is so strongly connected to racism in the context of the Roma community, to anti-Gypsyism. and you cannot really separate the two out. Melinda, over to you.
Thanks, Amal. I really like how the conversation actually steered towards speaking about power, because I mean, answering the question on the consortium first, I'm all for the consortium approach because it addresses the whole issue of power dynamics, because it's a very consultative approach where the power is actually transferred back to the implementing organizations and communities rather than the traditional donor and implementing organization kind of dynamic. And I think personally as well for us, it's been very refreshing because it allowed different organizations and activists to work together while we're cultivating exchange of good practices and also pooling in resources whenever possible. And I think that's how this Together We Can report also came to life. And working in solidarity has been very helpful, especially for national campaigns such as us, who are more self-led and smaller, to be actually part of a larger global consortium. Very quickly, because we're running out of time, on the closing note as well, I think there is just so much of urgency that has come with the pandemic. The pandemic has placed the whole world at risk, but it's important for governments to stop denying that access to legal status or statelessness is a problem and acknowledge that discrimination in nationality laws continue to impact families, women, and children on a daily basis, because we see that there is a lot of denial on the part of governments in actually acknowledging the problem. And while the pandemic has put the whole world at risk, there are communities that are further sidelined and marginalized without access to fundamental rights. And stateless persons and children without access to citizenship or a valid legal status are falling through the cracks every day and are being placed in vulnerable situations. And while we strongly believe we can work together, we want to be able to work together to address this issue. So yeah, thank you.
Thank you so much, Melinda. And thank you to all the panelists, both the speakers and the discussants, as well as those of you who intervened with your comments and questions. Please allow me to take a moment to also thank our wonderful team behind this report, all of our consortium members from around the world, the fabulous ISI team. I think I have to name Otlene and Georgia and Elena and Vera in particular for the real hard work that they put into coordinating and writing and researching and then making the report look the way it does. Also, thanks to Grant Mitchell, who's come in and advised our consortium on strategy and advocacy in a very kind of thoughtful and meaningful way. Thank you to everyone, Monet and Sam included, who shared messages, and Mustafa as well, who shared messages endorsing the report. We are very grateful for this endorsement and this recognition that we have produced something that we can now confidently say has some value and hopefully will be picked up and used to make a tangible change. Thank you to all the donors of the COVID-19 consortium. Without your support, obviously, we wouldn't have been able to implement what we have done. But really thank you to all our partners who have endured extremely difficult circumstances to deliver on this consortium. There's a paragraph in the report in the introduction which sets out some of the different risks and challenges that our consortium members have endured. And it's a very chilling thing to read, actually. And it shows that human rights defenders are always at risk, and we always need to stand with them. My final concluding message is to the stateless people of the world, some of whom are members of our consortium, some of whom have been directly engaged with the consortium, and most of whom probably aren't even aware that the consortium exists. But we do exist for a reason, and the reason is to center you, to cede power to you, as Sam put it, and to fight for your right to nationality and to fight for all of your rights. So thank you everyone for joining us, and I wish you a fantastic day and weekend ahead. And let's come back together because we have a lot of work to do. As the report says, together we can, and together we must make a change. Thank you.